Hello and welcome back to Mother Tongue, your eyes, ears and finger on the pulse for all parents around the world. Let's get going, shall we?
We are so incredibly excited to welcome Dr. Frankie Harrison back to Mother Tongue today. Dr. Frankie, how are you?
Yes, I'm good, thank you. How are you?
I'm good. It's Friday. I have that Friday feeling. The weather here is starting to cool down. I feel like winter is coming. And when I say winter is coming, I feel like you're thinking, oh my God, she's a nutter. But winter is like our brilliant time of year. And I'm so ready for the humid sweat fest that is Dubai at the moment to be firmly over. So yeah, I'm excited. Roll on the weekend. I feel like it's been one of those weeks that's felt incredibly long. Yeah, it's just snapped by in a blink of an eye. It's
I feel
weird.
like that's just life now as an adult and a mum. Like,
As
I
a
feel like
parent.
that's just what happens. Yeah, completely.
Yeah. It's really strange how kids make time go really, really quickly. I'm still trying to figure out why and how,
Yeah, I know, it's weird.
but that is it. Anyway, enough about me and the weather and complaining about the sweat fest. For everybody who doesn't know you, Frankie, can you please just tell our lovely listeners a little bit about yourself?
Yeah, for sure. So I am called Frankie. I am a clinical psychologist and I am a parent who has been through neonatal care and kind of all of the turbulations that kind of come with that. We run a company called Miracle Moon and the NICU space, and we support other parents going through similar, either past, present, or future.
And speaking of, you said that you'd had a bit of experience in the NICU. Can you just tell us a little bit about your own pregnancy and birth experience and what led you to this experience?
Yeah, for sure. So I was pregnant in 2019. I had a pregnancy that was like nothing, like not what I was experiencing, I guess. I had so many different pregnancy symptoms, everything that I went to the doctor with kind of being like, I've got carpal tunnel, I've got nosebleeds, I've got like it was literally like, what is going on? My body was just like, yeah, everything. So I was a frequent flyer in the doctors. I went to the doctors because I started to have swelling in my hands and my feet quite a lot, and they kind of normalised it, said that's fine. A lot of people get that. But kind of returned because I was like, I can't do my shoes up, like this feels quite excessive.
Oh my God.
Yeah, like I had to buy like new boots because I couldn't put my boots on type thing. I like all my rings on my fingers like wouldn't fit. So I kind of chased it up again, went back again, and it was like, okay, your blood pressure's quite high, we'll send you to midwife. Went to the midwife and she was just absolutely furious that they had sent me home because of how high my blood pressure was, and I got admitted quite quickly. I stayed in hospital for maybe a week with trying to get my blood pressure down with medication. I managed to get home for a couple of days, but then I was very quickly back in, and my the blood pressure kind of escalated into preeclampsia, which is where you have the blood pressure spiking, you have protein in your urine, and what basically happens, it like in really, really like crass terms, is like all of your organs just start to shut down. So yeah, so like my liver stopped doing its job, like your brain can start like swelling, so I was getting like headaches and like you're not able to like see properly.
Oh gosh.
So I think when people think preeclampsia, you kind of think, oh, it's a high blood pressure thing. But what the result of that can be really quite catastrophic for people if they're not catching it
And can I
early.
ask, is there any rhyme or reason as to why this happens, or is it one of those things that you're going to get it or you're not, and that's just kind of luck of the draw?
There's risk factors like with everything about kind of health and age and weight and family history and previous blood pressure and all of those kind of things. But you can get people like there's athletes who are developing preeclampsia who there's
Yeah.
like I don't know why this is kind of happening.
Oh
For
my
people
God.
who have got those risk factors, they tend to put you on aspirin during your pregnancy. So if you've got like two or more, they put you on aspirin during your pregnancy, and that is supposed to help, which I had in my second pregnancy, and it did help for me. But yeah, there's risk factors, but you know, there needs to be more research on it really as to why it happens.
How terrifying.
Yeah, it is. And you know, it can escalate to the point where it's really severe, and in some cases fatal. For me, it got to the point where they were like, okay, this is getting to the point now where we're like, we can't keep the baby in anymore. Like, it's more risky to keep the baby in than it is for the baby to be out. And there was a lot of emotion around that, because every time they did a scan, they were like, he's happy, he's kicking away, he's good. It wasn't like the baby was like
Under stress
or wanting to come out. It was like my body was just failing. So I struggled with that quite a lot, because I was like, why can't I do it? I'm supposed to do this. I'm supposed to be able to do this one thing type thing. Which was a process. But at 31 weeks, I had an emergency section, and he then spent 5 weeks in neonatal care after that point, with kind of everything that goes on in neonatal care, different procedures, tube fed, oxygen, different scares, the roller coaster that is neonatal care. And then we came home, and I was like, what have I just been through? Like, it felt like whiplash. It felt so quick. It felt like I was completely dissociated and numb, like, but also completely panicky at the same time. I started to have like really vivid, intrusive thoughts and images, high levels of anxiety. Like, I felt the need to just be in control, and like, I didn't want anyone else touching him. And I got to the point where I was like, okay, I feel like I need to kind of reach out and see whether other people are feeling this too. And I couldn't really find anyone talking about it.
Oh, that's wild.
So I connected with one other person, Georgie, who I now run Miracle Moon with, over the internet, because we then hit lockdown. So that's how people started connecting with each other, was internet. And she was like, we've had a lot of really similar experiences. I feel really similar to how you have. We both had our babies at 31 weeks. And we decided that, with me being a clinical psychologist, her being a graphic designer and techie, which we were talking about earlier, which I'm not, we kind of had, we need the techie.
Your skills, yes.
We kind of thought, we've got something here, and we created Miracle Moon, which is now grown and grown and grown, and it is just a community for parents who have been through neonatal care, and we do all sorts with that now, which is brilliant.
That's amazing. I mean, I have so many questions about neonatal care,
Go for it.
but I just wanted to ask, with regards to your own experience, so babies that are born before a certain point, and it's 37 weeks, is that correct? Normally need to go into the NICU. Is that?
Yeah, so there are some babies who are born 35, 36 weeks who are stable enough and that they are okay. They're still classified as premature, so before 37 weeks is premature. But there's some babies that do okay. But you can have term babies who also need support in the NICU, and actually 60% of hospital admissions are made up of full-term admissions.
Really? Wow.
Yeah.
And when your baby is born around like the 28, 29, 30, 31, 32 mark, what's not developed enough to sustain them outside the womb? What are because I mean, I know that babies, they're changing, developing, growing things all the time until the kind of very end, when they just fatten up a little bit. So what were they really watching out for at this stage when you gave birth at 31 weeks?
I think it depends on your baby and how they have developed so far. As I said, my baby was kind of doing okay. He was still getting the blood flow that he needed. He was still getting what he needed when he was inside. So he came out and he was in a relatively good position. He was small, so he was £3.1, and then kind of dropped to £2.9. So was dinky, but he mostly needed support with being able to feed. We had various stomach issues, and at that point, when they're like 31 weeks, the tummies aren't quite ready for milk. So you kind of get lots of different kind of reactions to that, gut reactions to that. They've had antibiotics as well, which also kind of can mess with their gut. They have issues most probably with breathing, growing temperature. You'll get babies who have kind of brain development stuff that's going on. Basically, when you're like following the app and you're like, "What's my baby doing today?" They're still needing to do all of that just outside in the incubator. When they're really tiny, when they're micro preemies, so babies that are born from 22 weeks kind of onwards, they're still doing things like developing the thickness of their skin. So their skin's like really, really like translucent and fragile.
Oh my God. Wow.
And like sight and hearing and all of that.
Oh wow. So I mean, what is the youngest that you might get a NICU baby?
22 weeks.
22 weeks. Wow.
Yeah.
Wow,
Yeah.
so small still.
Yeah, absolutely. Absolutely. So tiny.
And I mean, you mentioned then that there is a large percentage of full-term babies in the NICU. Why, in general? I mean, I know that the list is probably endless to this question, but why, in general, do babies go into NICU? What are the main kind of red flags that a baby might need to go in?
The main is that they're either premature or they're poorly. So they're born before 37 weeks and they just need some support with growing, or they need some help with breathing, or you get a baby who is born at term, and with those term babies there might be kind of less serious reasons why you might go in. So it might be things like jaundice, it might be just needing a little bit of breathing support, maybe having an infection if it's not too bad, but there might be things like bleeds on the brain, or different physical health issues, genetic conditions that babies have, like a whole host of different reasons that are completely complex. But you will have the different levels of care. So you have that kind of first level that is breathing and feeding support. Then you have a kind of more intensive support, so the babies who maybe need a little bit more. And then you have this kind of level 3 or surgical, where they're needing a lot more procedures, or like heart surgery, or brain surgery, or whatever it is.
Oh my gosh. And just for people who don't know, and to be honest, my knowledge is really, really limited. What is the NICU? I mean, if you were to describe a NICU unit, what are we going to find in there?
It's intensive care. So the
For a
intensive
baby.
care for a baby. So what you would, the stuff that you would kind of see in an intensive care for an adult, that is what is going on for a baby. So when you walk into a neonatal unit, you will see lots of incubators, lots of kind of plastic boxes on wheels with a whole load of different machines kind of linked up to the baby. They'll be covered in different wires that are monitoring their heart rate, their blood pressure, their oxygen. They'll have tubes to help them feed. Some of them might have masks on to help them breathe, jaundice lamps to kind of help with the jaundice levels. When you're in there, you will probably hear lots of beeps, but they tried to keep it as quiet as possible, because what they're trying to replicate, and what the best neonatal units are doing, is trying to make it so that it replicates them still being in the womb as much as possible. So they'll keep the lights kind of low, they'll keep the sound as low as possible, they'll try and make it so that it's warm, so you are hot in there. But there's lots of parents just kind of sitting next to the incubators. And then as you get to the lower down levels, you'll find babies that are in kind of open cots, that you'll be able to kind of just get out as and when.
So talking of your experience in the NICU, were you able to stay with your baby? Were you able to touch your baby? What kind of level of interaction did you have? And I mean, you were there for 5 weeks, so can you just talk us a little bit through your own personal experience whilst you were in there?
So there was, when he was first born, he was taken away to NICU fairly quickly. I've got a very quick picture of him being in the same room as me. but I can't remember seeing him. And then he was taken to neonatal care quite quickly, and my husband followed and kind of was with him for a bit. I was then in recovery and on the maternity ward, and they don't let you go and see your baby until you're medically stable. So that can be different for everybody. And for some people, they're kind of like, okay, no, we really need to get this mum and baby together, and they try and facilitate it. But with hospitals being understaffed, that can sometimes be really tricky. So I waited a day until I saw him.
Oh my God.
There's people who have it a lot longer, and it's really incredibly painful.
That's
'Cause
horrid.
you need to
Can't
start
even-
expressing and kind of getting
Yeah.
love for the baby without
Yeah.
having seen them. So it took a day, and again, the memory is really hazy. My memory about the whole thing is super hazy. Knowing as a clinical psychologist, that's a trauma response. It's just like, not being able to be present, not being able to lay down those memories properly. But I've got pictures of us first meeting. And in that first meeting, I was allowed to put my hands into the incubator and kind of touch him. I was told not to stroke because that can be too overstimulating. So just putting a hand on your baby. But they're kind of covered in wires and tubes and masks and stuff like that. So I just remember, and I just had a section. So I was sitting on a wheelchair, and I just remember being like, I can't see him. I can't see what he looks like. And I remember them saying to me, what's his name? And me being like, how am I supposed to name him? Like, I can't see his face. I don't know how to do that. It was maybe then another day later that I got to hold him. And they do skin to skin. They call it kangaroo care, which is where they kind of get the baby on you, and they're kind of still covered in all the wires and stuff, but they've just got their nappy on. You've kind of got your top off, and you kind of wrap blankets around, and you just kind of sit there and hold them. And all the research, everything that we know, is the benefits of doing that skin to skin. And the earlier that you can do that, the better for the baby and the parent. So they're trying and they're working hard in a lot of places to be able to make sure that babies get that contact with their mums, with their parents, as soon as possible.
Wow. I just can't imagine. I can't get over the fact that you had to wait a day. I mean, I remember finding a C-section. I'm guessing yours was an emergency in the sense that it was kind of like, right, it's now, we're going.
Yeah.
And feeling that just a massive disconnection from the whole experience, because I was like, what is going on? And then the next minute, they were like, oh, here's your baby, like on my face. And I was kind of like laid flat. Can't remember really being able to move my arms or anything. And I was just like, this is strange. What's going on?
It's so hard to make sense of.
Yeah. And there's like a real lack of connection as well. You feel like you can't build that connection because the whole thing just feels so strange. So I can't even begin to imagine what it must have felt like to then have your baby taken away from you, not see them for a day. And then when you do see them for the first time, they're in a box in the NICU.
Yeah, I mean, I remember kind of going in, being wheeled in, and being like, well, which one is mine? Like, how am I supposed to know that? I haven't seen them. I don't know what they look like. So there's huge disconnection. And I think there's bigger issues with bonding. Of course there is, because there are so many barriers to that disconnection. So you get, you hear about this rush of love, but I think it's more common for parents who have babies in NICU it's a trickle. And that's okay.
Yeah. And I mean, the NICU units in general, like, I can even imagine it feeling quite a supportive place in the sense that you're all in it together. You all can relate to what each other are going through in some way, shape or form. But I can also imagine it being a really traumatizing, terrifying place.
Yeah.
Because there must be things going wrong around you also quite frequently.
Yeah.
I mean, do they do all the testing and everything like that within the NICU unit, or do they take the babies out and then bring them back? Like, how does that kind of side of things work? If something does go wrong, is it something you would see as a parent if someone else's child, like, I don't know, do buzzers go off like it does in intensive care? Yeah. Oh, God, so horrible.
So I think, we talk about having that kind of trauma and that PTSD, which is common for NICU parents,
Yeah.
for your own baby, but it's also the fact that you are around other babies experiencing other things as well. So they will have to do potentially CPR, or they would have to, what they tried to do is they tried to keep the babies on the unit as much as possible and not move them as much as possible. So they might set up a sterile environment around the baby if they needed to do any kind of procedures. But if it's bigger operations that are needed, they'd need to go to an operating theatre. But they do things like bring in x-ray machines and just kind of clear the room. So they try to keep everything kind of on the unit. But then that means that there's just a load of medical people and equipment and stuff like that all the time.
Yeah, I can imagine. And also, I mean, again, I guess it's their job that they are, but I can, like, from my own personal experiences with dealing with hospitals, people aren't always up front, but I can imagine with your baby, you're like, I need updates and I need them constant. Were they quite good with the communication in being able to honestly inform you what the progress was and how your baby was doing?
For the majority, they're really keen on you attending the ward rounds. So
Okay.
that means that whenever they happen in the day, that you are there and you are a part of the team.
Okay.
So they talk about having family integrated care. So that means that, the family as a unit, you're looking after that baby together. So
Yeah.
every morning I would make sure that I was there for that ward round, where I was getting updates from the doctors, I was getting updates from the nurses. You can have OTs, physios, whoever is involved in that baby's care, kind of all updating all at once. And then if there's anything else, you've got your kind of named nurse for the day that you can talk to, and they're usually incredibly supportive.
That's good. That's good, because I can imagine if people aren't communicating with you, it just makes things a million times worse. And I mean, in terms of like visiting hours and things like that, could you stay? Did you have to go home each day?
Visiting hours have generally been taken away,
Okay.
and it's now like parents aren't visitors. So
Okay.
they are parents. They should be able to be there,
All the
but
time.
but there is no space for the parent to sleep. So
Oh,
there
brilliant. So what? It's you
there might
sit and
be
stay
like
up all
there might
night.
be like two beds. Well, yeah, that's the difficult thing, right? Because you either post section prop yourself up in a chair that maybe isn't that comfortable and stay there all night,
Oh my
or you go
God.
like, I have to rest and I have to recover. And the majority of people go home and they sleep overnight and then they come back to the NICU.
Wow.
Ideal world, you would have it set up so that you have a bed there, so that you're
Yeah.
able to, and there's some units, and again, I think we're going to look back on this in 10-20 years time and be like, what were we doing? Like, I think we're going to get to the point where we're like, families are living on the units or close to the units, and that is the norm, and that's how it should be. And charities like Bliss in the UK are really pushing for that, so that there isn't as much separation. But for the majority, and for me, it was that you were there for the day, you go home overnight, you kind of leave the hospital, you go and sleep, and then you come back in the morning.
And I mean, how was that emotionally, like mentally,
Oh
just
my God,
knowing you had
awful.
to leave every day, and then someone's like, "Yeah, go rest."
Yeah.
It's like, what rest? Like, my brain is not switching off right now. It is running at a
No,
million miles an hour.
no.
I've come home without my baby. In what world is that okay? I mean,
Yeah.
for any parents who are having to go through that at the moment, what were there any resources or anything that really helped you kind of get through those nights? 5 weeks of nights. Well, I mean,
Yeah, I
it's
mean,
no
at the
time.
beginning, I think I was just a mess. Like, I was just like, this is not how it's supposed to be. I'm supposed to be walking out of the hospital with my baby, like going home to a kind of empty house. It was like, what? Like, it felt again so surreal. Like, this doesn't feel right. It's not how it should be. The separation was so much, and it felt so big. And you're still up every 3 hours pumping, expressing for your baby anyway. So it's not like you're going
Yes.
home and sleeping and having a lovely time. You're still kind of doing those wake ups to be able to feed your baby, bring in the milk. But after some time, I developed a bit of a like goodbye for now routine. So it would be like we'd make sure that we got cuddles before I was able to leave. We'd do a feed. I'd read him a book. I'd kind of put him in his bed, tuck him in type thing, as if it was like doing a good night kind of routine.
Yeah.
The trickiest times were when he was awake, because then it was like, now I've kind of got to leave, and you'd kind of be waiting for them to kind of like drift off. But then you'd have a ride outside because you can't drive yourself to the hospital because you've had a section. So you're waiting for people to kind of pick you up. But that was probably the trickiest part. But that really helped me kind of feel like I had some connection there.
Yeah.
I've said goodnight. I've made sure that he's safe. I had a handover with the night nurse, and then I went home.
And you mentioned then feeding, you were getting up in the night to pump.
Mm-hmm.
How does the NICU kind of affect, I mean, I can imagine it massively affects your breastfeeding journey in general, but what do they advise in terms of breastfeeding? Is it to pump more and contact feed less, or contact feed as much as possible, or is it kind of case by case? And I mean, when you're not there with your baby 24 hours a day, it must also be incredibly hard to keep your supply up. Like, how did you tackle that whole minefield of breastfeeding in general?
Yeah, so they tell you that you need to express colostrum within an hour of giving birth, and that's going to be
no pressure.
Yeah, no pressure. You've just been through all of that, and essentially what I had was I was completely out of it, and I had a nurse come and milk me. It is what it felt like. Like, I know. But you're generating these tiny bits of colostrum, and you're like, what is this? What is this? Is this enough? And your body's been through such major stuff. You know, that kind of cortisol that's kind of coursing through your body because you've been through so much kind of blocks that oxytocin that you need to be able to produce milk. So whilst you've got the physical distance and all of the blocks in terms of the bonding, you've also got all of the bodily stuff kind of going on, which makes it really difficult too. But a lot of people say pumping feels like the only thing that I could do. And there is such a huge pressure, it feels like, on expressing, especially for a baby who's really poorly, because breast milk is the best thing for a very poorly or premature baby in terms of their gut. Yeah. But there's so much pressure. And it doesn't always work. Like, you will get more kind of supply issues and people struggling with feeding journeys, and there's such a grief around that for so many parents.
I can imagine. Oh, it's such a tricky one because, as you said, it's like everyone kind of preaches that breast milk is like gold dust, but again, you've got so much on your plate already. How are you expected to do that? And still, I mean, I'm guessing it's still fed as best. Regardless.
I mean, there is a different level of pressure in a neonatal unit to be able to express. But they have things like, they give you the hospital grade pumps. They have like an expressing room. They set it up as much as possible so that you are able to do it. They encourage you to do it while you're cot side, so that you're with your baby, so that you can kind of see them, and that can help with milk supply. They encourage you to do it every 3 to 4 hours so that you're keeping your supply up. My issue was actually the opposite, and I ended up with an oversupply because my baby was so little, and there were a few days where he was nil by mouth, he couldn't eat because he had some tummy issues. So my boobs were like, hey, here's all this milk, and my baby wasn't taking it. So I ended up with a load and with mastitis and all of those things.
Oh my gosh. See, I actually remember my firstborn was allergic to my milk. And I had so much milk with my first and barely any with my second. It was very bizarre. But I remember I freezed it all and then made like breast milk porridge for about a year afterwards. And I was just like, I don't know when this is going to end. It's quite weird that I got my little baggie of frozen breast milk out the freezer. But yeah, the joys.
Yes, we bought a whole new freezer because it was
breast milk freezer, breast milk central. But just in terms of like babies being in the NICU, I'm guessing this kind of changes from baby to baby. But what is like the average length of time that babies are normally in there? And then when it comes to them leaving, is there quite a comprehensive leaving process? Do the babies need to tick certain boxes before they're allowed to come home?
Yeah, so all of the boxes need to be ticked. They need to be kind of, some babies come home with an NG tube, so a tube through their nose to be able to feed still, and we did. So I'd got to the point where I was able to breastfeed for 2 consecutive feeds, and that was the criteria for my hospital, and the rest could be done through the NG tube. That was just in case the NG tube slipped out and I needed to wait for 6 hours to be able to have it put back in. Some babies come home on oxygen still, but most of the time they're wanting babies to be kind of eating on their own. They want to be maintaining their own temperature. They want them to be stable enough to come home. But obviously some babies continue being poorly, so just have that home support. It just so hugely varies. Obviously, the more premature your baby is, the longer that they will need in hospital, and they kind of set an expectation of, imagine kind of staying in until your due date. So if your baby's born at 22 weeks, that's staying in until 37 to 40 weeks, in that point. And people have hundreds of days of being in neonatal care. And there's some really poorly full-term babies who need that extra care, but then you might get some babies who go in for a couple of hours, or they go in for a couple of days, and that's still hard. That's still incredibly difficult for people, but it hugely varies.
Can you talk me through the process of you taking your baby home for the first time, and just the emotions that came with that? Because again, something that must have been so exciting, but also so incredibly terrifying all at the same time. Like, what a mix of emotions.
It was exactly that. I think I was like, we had a couple of times where they said that they were going to discharge us, and then he didn't meet what he needed, the criteria, like the last one, which was the temperature. So they would take off his hat and stuff like that, make sure that he maintained his temperature, and he'd drop by like half a degree, and they'd be like, no, can't do it today, and I'd be like, no. So you were waiting for that process, and on the day I was like, can we go home today? And she was like, I think you can. And I was like, really? So it then felt quite like rushed, like we were getting all the paperwork, the discharge paperwork, getting him ready, and it kind of felt like I was kidnapping him. Like, it felt like he shouldn't really be coming home with me. I felt like they were going to turn around and kind of go, no, you need to come back now. It didn't quite feel real. But that moment of getting home and sitting on our sofa, watching TV, being comfortable, like we had the dog, all that kind of stuff, I just remember it, and it was just so lovely, just being able to do that bit that you imagined kind of finally. And I think for a lot of people there is still fear, because the monitors, the nurses, the checking, that all does create an element of safety, even while the NICU is a scary place. So to then not have that can then feel really, really difficult for a lot of people too. So it's a whole mixed bag of emotions.
I can imagine. I mean, I don't get me wrong, I don't love hospitals as a place, but there is a certain sense of security and reassurance that comes with hospitals, because you're like, if anything goes wrong right now, there are lots of people within shouting distance who can come to my aid super quickly. And for me, that feels super comforting. Whereas obviously at home, the process is a lot different. And also you're relying on your own intuition as a parent, as opposed to a medical's intuition. And you're like, is something wrong? Is something not wrong? I mean, I am an anxious person when it comes to newborns, especially. Like I remember with all my babies, I'm now pregnant with my third. I can't imagine I'm going to be any different, even though they've all been like perfectly healthy, born full term. I've been incredibly lucky in that sense. I'm still terrified that they're going to die in their sleep. I don't know why. I have this like deep down fear that I'm like, my God, and I check them constantly. I don't sleep well for 6 months.
Yeah.
And then you get to the rolling stage and you're like, oh God,
Yes.
here's another curveball. Great. So I can only imagine. I mean, what were those first few nights like? Did you just sit there and watch?
Yeah. Yeah, completely.
Oh,
I think I
bless.
did that for weeks, because we still had issues with reflux as well.
Oh, God, no.
And we had we continued to have various issues. So like his larynx wasn't properly developed, so it would close sometimes, meaning that he couldn't kind of breathe and stuff like that. So I felt like I was always watching. I was always on guard. I do that bit of waking up in the night, like just like like if you've been asleep,
Yeah. Yeah.
and just the level of anxiety that there was a baby here that wasn't being monitored and it was my responsibility. That was the bit that I struggled with the most.
Yeah.
So I did the extra stuff, the checking, the monitoring, the reassurance seeking, the everything, all of those things that maintain anxiety and make you feel worse in the long run, but you feel like you need to do them at the time, all of those things. But it was a long process, and it got to the point where, like, I think I didn't recognize it in myself. It wasn't until I had a friend, and we actually ended up having a fallout, where she was like, you're not the same. And I was like, well, of course I'm not the same. Like, what have I been through? But it wasn't until like I was able to kind of catch myself and be like, okay, there's something going on for me here,
Yeah.
that I was able to kind of go, this is postnatal anxiety. I need some support with it.
Yeah, and I mean, let's talk about the support, because again, I mean, to be fair, I don't blame you. I don't blame you being the way you were, because I would be exactly the same, and I'm sure so many parents who have been through that experience would be exactly the same. But how did you get that support? What did you find really helped you kind of get through this really difficult phase of your motherhood journey?
I think that's why we set up Miracle Moon, because I couldn't find it. So I went to the GP. I told him everything that I was struggling with. I wasn't unwell enough for perinatal mental health services, and there weren't specific services to be able to support a parent other than that. So it wasn't like, and a lot of parents who go through neonatal care kind of get missed through the gaps, because quite a lot of places don't really recognise trauma. So if you're not ticking those boxes for postnatal depression, or that kind of level that they need for, psychosis, or in the UK particularly, then it's like, well, where's the support? It depends on where you are. Some places have wonderful charities. Some places have wonderful kind of NHS setups. My place wasn't like that. So it wasn't available to me on the NHS. And I had to kind of find it privately. And I was lucky enough to be able to do that. But there are a lot of parents who aren't. So we wanted to set up a space where we could support people with community, because we know how powerful community is. We wanted a place where people could get access to information that they needed that was specific about the NICU journey, kind of normalising thoughts, feelings, giving them cool tools to be able to cope with how they're feeling, kind of all the information that I would provide in the therapy room, but be able to, we've always kind of worked on scaling it. So we've got a bunch of stuff that's free. We've got a bunch of stuff that's kind of like minimal payment, where I'm able to do a bit more. We do group therapy, and then I do the individual work. But we've always wanted it to be so that we can reach as many people as we possibly can do, to give that support.
That's amazing. And I'm so glad that you're doing something like this, because, I mean, God, I can't believe that there isn't actually more already to support these women who are having to go through this. It's just wild, absolutely wild. And in terms of, for the baby, mostly the long-term side effects, I mean, does a trip to the NICU always involve long-term side effects, or can your baby be perfectly happy and healthy and normal kind of post that experience?
Yeah, no, it doesn't always. Babies can recover. They are more at risk for pretty much everything.
Okay.
Kind of neurodevelopmentally, developmentally, like cognitively, physical health wise, prematurity and being in NICU is a risk factor for all of those things.
Yeah.
There is a lot of uncertainty when you leave the NICU because you're like, what is this going to look like?
Yeah.
And that's really difficult to sit with. But normally by the time the baby gets to like 1 or 2, you can kind of get a bit of an idea of where they're at, how things are doing. And in the UK, babies kind of get discharged at around 2 years from being underneath their neonatologist. So
Okay.
if your baby's like, yeah, you're doing well, you don't need anything else, you would get discharged at that point, or you continue to be under specialists who are supporting you with any kind of physical health or cognitive stuff.
And what about your experience? How was your little one after the
He's
2-year mark?
he's brilliant. He started
That makes me
primary
happy.
school. He's going to be 5 this year. He is a little Spider-Man. Like
Oh,
he's
sweet.
brilliant. He's still tiny. Like he's going to school in like 2 to 3 year like trousers and stuff.
Oh,
But me and my husband aren't giant, so I think that's part of it as well. We've got some kind of queries around whether there's anything kind of neurodiversity wise going on for him, but that's kind of just something that we're just holding and just seeing how he gets on.
yeah.
But he's brilliant. He's absolutely brilliant.
Oh, bless him. Oh, I'm so glad. That makes me so happy. And I mean, you mentioned you've had another child since, and was that a better pregnancy in
It was a
terms of
Yeah, it was. Yeah,
all
it was
the
a better
no
pregnancy.
preeclampsia?
No, my blood pressure spiked at the end, but it
Okay.
was at 37 weeks that my blood pressure
Okay.
spiked. So they were just like, okay, let's just get her out now because we
Oh,
don't
you
want
had a
this
little
to
girl.
escalate. Yeah, I had a little girl. They didn't want to kind of risk it. They didn't want it
No.
to kind of go into preeclampsia. So I had another section with her, but it was a completely different experience.
Yeah.
I'm not going to romanticize it. I'm not going to say that it was a healing one. It wasn't. It was still incredibly difficult, and there were a lot
Yeah.
of hurdles with that. And with her, there was a lot of grief that I was experiencing from my first and what I missed out with my first. But she is incredible and an absolute firecracker. And
Good.
yeah,
Oh, that
great.
makes me happy. That makes me so happy. And I mean, in terms of just wrapping up now, I mean, I know you've created this incredible new company called the NICU Space, or am I saying that right? NICU
Yep,
Space?
that's right. Yep.
Can you tell us a little bit more about this and how it will support parents and families who have been in the NICU?
So it is a community, it's a membership that we have created that has peer support from professionals. It's
Wow.
got live events, it's got chats for kind of everything that parents have been through. So we've got chat spaces for, twins and multiples, preemies, full terms, a whole bunch of different stuff. And we've got information and resources that take you through the whole process of being in the NICU. You found yourself, you've landed there, and you're like, what sense do I make of this? Like a glossary of terms, how to get involved in ward round, how to do the bonding, the feeding, like everything that we've spoken about,
Yeah.
all the way through to leaving the NICU and years later. So we've kind of written information, we've got workshops, resources, videos, audios, and all of that kind of thing, and talk about things like common triggers that you might have when you're kind of out. So birthdays and anniversaries, returning to work, starting childcare, all those things that might be really tricky, managing things like flashbacks, postnatal anxiety, OCD, and then a bunch of different coping tools as well, the stuff that I would use in the therapy room with people so that people have that access, those resources there. And we're just going to continue to grow. We've got a number of different professionals involved as well who are supporting. So we've got physios, OTs, lactation consultants, and it's just getting bigger and bigger with more people wanting to kind of support us and help parents too. So we're hoping that it's going to be this kind of one-stop shop, this place that everybody can come.
Yeah.
And they're like, okay, I know that there's a professional who can help me with this. There's parents that can support me. There's, a whole host of support and information and everything. Yeah.
That's amazing. That's amazing. And if people want to find out more about that, where can they find more about the NICU space?
So we're at Miracle Moon UK. So
Yeah.
you can find us on Instagram there. You can find link in our bio, which will take you to the NICU space, or our website, which will take you to the NICU space.
Amazing.
But Miracle Moon UK is probably the best where you're going to
Cool.
find us. Yeah.
obviously I will link all this. And before we say goodbye today, Frankie, we always ask our guests to leave us. Oh, sorry, let me rephrase that again. We always ask our guests to leave us with one tip and one product. So if you were going to leave us with 2 nuggets today, what would they be?
The first one is that no matter the length of time that you have spent in neonatal care, if you have found it hard, it was hard. People kind of get into this kind of comparison. I was only in there for so long. I was in there for, however long it was. And if you found it hard, it was hard. Of course, if you're in there for a longer period of time, you're exposed to a lot more, but that you can't kind of quantify the difficulty of what you experienced based on the length of time that you were in there. Yeah. So I think that I would say that I would kind of, if I could have it tattooed on me about having your emotions being valid, your experience being valid, I would do. Like, it's, if you feel it, don't try to squash it, don't try to minimize it, listen to it, and it's important.
Yeah, I love that. And what about a product?
So, I mean, I would say our stuff. I think.
Do it. Okay. Yeah, plug.
I just think this is what we needed. The NICU space, Miracle Moon, is what we needed, and it has been born from two parents as well as, someone who's a professional, but it is from parents supporting parents. So it's needed. That's why we've got it, and it is, it's exactly what we needed. So I'm hoping it can help as many parents as possible.
I mean, it sounds like you've already helped loads of parents, and I have no doubt that you will continue doing such incredible work. So thank you. Thank you so much, Frankie. And thank you for being a guest on Mother Tongue today. I've so enjoyed catching up and hearing more. I've so enjoyed catching up and hearing more about your story. For anyone who wants to reach out, where can they find you on Instagram?
Yeah, so we're at Miracle Moon UK. We're at www.miraclemoon.co.uk. We're on LinkedIn, we're on TikTok, we're on Facebook, but the main place is Instagram.
I mean, you are very busy in the social sphere. I'm very impressed. Unlike us, we are only on Instagram. And as always, everybody, you can find us on Instagram at We Are Mother Tongue. If you've enjoyed this episode, also please feel free to leave us a little comment. We love to hear from you. And I will link everything we discussed today in the show notes. So feel free to take a look down below and find out more about Frankie and the NICU space and Miracle Moon and everything else. Frankie, you have been incredible. Thank you so much for being a great guest on Mother Tongue today. I've loved having you on a Friday, and enjoy your weekend.
Thank you, you too.